Since the earliest days of the COVID-19 pandemic, we've been watching the tension grow between individual freedom and community well-being. This tension is playing out in election politics, in interpersonal relationships, and even at the grocery store. So what is our obligation to one another in COVID-19 times? And how do we balance our commitment to the greater good with our desire to exercise personal autonomy? Joining me to help answer these big questions is Assistant Professor of Philosophy, Sam Asarnow. Dr. Asarnow's research focuses on ethics and the philosophy of action, with an emphasis on questions about the ethical significance of human motivation. Thanks for joining us, Professor Asarnow.
Thanks for having me.
Let's jump right in. As we've seen this tension play out between public health and personal well-being during the pandemic, what questions have you been asking yourself as a philosopher and as someone who thinks about ethical decision-making?
Well, one of the first things I tell my students when I teach Introduction to Ethics is that every time you make a decision, you have an opportunity to do some ethics. If you're willing to think about that decision in light of your values, in light of the possible effects of your behavior on other people. And that's true whether it's a big life-shaping decision or whether it's an everyday decision. In a lot of contexts outside of a pandemic, those everyday decisions are not very ethically weighty. Often, not very much depends on whether you're going to go to a restaurant or go to the grocery store. But one effect of the pandemic is that it's made a lot of these everyday decisions a lot more ethically weighty. When there's a possibility that if I go out into the world, I might get sick, get a family member sick, have to send one of us to the hospital, or I might get someone else sick, or I might get many people sick. When those are the risks of ordinary everyday activities, suddenly these everyday decisions become really ethically weighty. And to be honest, one of the decisions that I've been thinking about the most and the questions I've been thinking about the most over the last 6 months have been those everyday decisions. I've been thinking about these questions. Should I go to the grocery store if all I need is a bag of coffee beans? Should I go to a restaurant? Should I go to the barber to get my hair professionally cut? These questions have been weighing on me heavily, and I'm not sure if I've made all of these decisions correctly. I have gone to the grocery store to buy coffee beans. I have not gotten my hair professionally cut, as some of my students have enjoyed pointing out. What these questions mean and the weight that these questions have means is that in addition to the costs of mortality and morbidity imposed on us by the pandemic, in addition to the economic and personal costs that many of us are facing, we're also facing what the philosopher Jennifer Morton has called ethical costs. Mm-hmm. Ethical costs are the costs of being in a situation where you have to make tough decisions all the time. Some of these costs are psychological, the psychological stress and anxiety of not knowing what the right thing to do is. Some of these costs are more strictly ethical. Nobody's perfect, we all make mistakes, and sometimes we have to live with ourselves when we realize we haven't done the right thing. So I've been thinking about the ethical costs of the pandemic and trying to bring myself into a place where I can feel more compassion for myself when I realize I've not always done the right thing, and when I can feel more compassion for others when I realize they've made decisions that maybe I wouldn't have made.
So do you think the obligations we have to keep one another safer are the same across the board? Or is it possible that some of us have more responsibility to curtail our personal liberties for the good of the whole than other people do?
Well, I do think we all have responsibilities to keep each other safer. And I do think we all have responsibilities to make sacrifices sometimes. But I don't think those responsibilities are distributed equally. There are several groups of people who I think have a greater responsibility to make sacrifices to keep others safer. One of those groups of people are folks for whom keeping others safer might be cheaper or easier. If you're someone who, for example, enjoys cooking and enjoys eating meals at home, then it might be relatively cheap, so to speak, for you to stay home rather than going out to restaurants. If you're someone like me who's able to do your job from home, who's, in my case, able to teach over Zoom, and that's something that you're able to do relatively easily, you might have more of an obligation to do that. A second example of people who might have more obligations are people who are better able to bear the costs of more expensive sacrifices. For example, buying in bulk rather than making many trips to the grocery store. If you're someone who has a spacious place to live with access to outdoor space, it might make more sense for you to have a staycation rather than going out. A third example has to do with these inequities in the way the pandemic has been affecting people. The pandemic has been affecting many different communities disproportionately. So BIPOC communities, communities of people who are Black, Indigenous, or people of color, poorer communities. These groups have been impacted disproportionately. And these are groups who are already subject to systematic injustice and systematic inequality. And what we're seeing is that the pandemic is magnifying those injustices and inequalities that members of these groups are already facing. One striking feature of these injustices is that many of us, myself included, benefit from the existence of these injustices and inequalities. And it seems to me that those of us who are benefiting from the injustices that are being magnified by the pandemic might have a greater responsibility to make personal sacrifices in order to reduce the risk that we expose to others.
That's great. Professor Asarnow, thank you so much for sharing your perspectives with us.
Thank you.